And this committee, Dr. Srinath Reddy is the chairperson of this committee, and probably he is again the best person to tell us about how this committee and the larger set of health activists and professionals in India can think about moving towards a system for universal health, access to healthcare in India. So, and another part of the national context is, as you perhaps know, that the Medico Friend Circle, which is almost 37-year-old, 38-year-old platform of health activists and professionals, is this year, in fact, just 2 days from now, starting its annual meet on the theme of universal access to healthcare, which will be attended by a very large number of health professionals and activists from across the country. So now, universal health coverage and universal health care is on the agenda. We need to start debating about it, discussing about it. We need to, there are obviously a whole range of perspectives. There are a very wide range of issues which need to be addressed. And I hope that this lecture and discussion today will be one input to taking forward this process of discussion and debate, so that we can actually begin to visualize and actually work towards, campaign towards, and build a movement towards achieving universal access to healthcare. So before I move on to our speakers, I'd just also like to remind you, as has been mentioned, that one of our colleagues from the health movement and from the human rights movement, Dr. Binayak Sen, as you all probably know, has been imprisoned with a very unjust and very, very unjustified sentence. And this is a situation where people from across the country and even across the world are protesting against this highly unjust sentence which has been given. There is a petition on this issue, on the issue of release of Dr. Binayak Sen, which is there outside, and I would request all of you who are interested to please sign the petition so that we can send it to the President of India and the Prime Minister of India. So now I'll move ahead with our speakers, and Dr. Armando de Negri Filho, who is from Porto Alegre in Brazil, which you may have heard about. He has been the coordinator of the Latin American Association for Social Medicine called ALAMES, which is a very large network of public health professionals, physicians, and health activists in Latin America. He has been the president of the International Society for Equity in Health, and he has worked on the issue of health equity in quite some detail. He has been the coordinator of the, the executive committee of the World Social Forum on Health, and he works with the Public Health Department in Porto Alegre. And he is an advisor to the governments not only of Brazil, but also of Venezuela, Colombia, Paraguay, and other countries in Latin America. So he has been actually looking at how the Brazilian experience can be used to help other countries to move towards universal access to healthcare. And personally, of course, I have known him as an activist of the People's Health Movement, of which, as you know, in India we have Jan Swasthya Abhiyan. Similarly, there are circles in other countries, and Armando is from one of the leading activists of the People's Health Movement in Brazil and in Latin America. And he is a public health physician, a committed health activist, and also, I would say, a socio-political activist. And he brings all these different experiences and backgrounds to his work. So I would request Armando to share with us his ideas about universal access to healthcare in Brazil and its lessons for India. Well, Armando.
So